what are peptides, right? We're going to keep this kind of very simple because peptides are simple molecules. We learned that peptides are the building, or amino acids are the building blocks of protein. That's something that we learned very early on in elementary school, something maybe second grade. And peptides are just little chains of amino acids. They give your body a signal. They tell your body, do something, go to sleep, add some color to your skin, burn some fat, build some muscle, repair something, increase blood flow. So peptides are small, little, simple signaling messengers made up of amino acids. If you have a chain of 50 or less, you have a peptide strand. If it's more than 50 amino acids, it becomes a protein. So amino acids are the building blocks of protein. They're also the building blocks of peptides. Um, And when there's so much kind of hubbub around this world of peptides because when we break it down and compare them, and I'm going to call them medicine for the simple sake of aligning it with the fact that you need provider doctor guidance and you should have a prescription and or medical approval while you're using these peptides, right? So I put them in the medicine category. They are so clean because they are just the pure molecule of what that messenger signal is versus a medication, a pill from a pharmaceutical company that has that active pharmaceutical ingredient, but it's got all these other things in it to stabilize it, to get to change bioavailability, to change releasing and what it does in the body. Right. So a medication from a pharmaceutical company is going to be that API, active pharmaceutical ingredient, plus a bunch of other stuff. A peptide, when you're taking it, is just the pure raw formulation of the powder that gives you the signal. Okay. So they're very clean, they're very targeted. And while they can be complex in molecular structure, in the way that they're intertwined and how many amino acids that they really have, they're very clean and they're very, very simple. Okay. So a peptide, the very first peptide that was discovered was in 1921. It was called insulin. Insulin's a peptide. GLP-1s, we're just going to put this out there right now. GLP-1s are peptides. Yes, they're weight loss shots. Yes, it's something that naturally occurs in your body. GLP-1 is a naturally occurring peptide that happens in your body when you eat something. Put a grape in your mouth, start to chew it, your body starts to produce GLP-1. Then your body also obliterates that GLP-1 within minutes. So what they do, they're great immune modulators or inflammatory modulators. They support repair, recovery, signaling efficiency. And again, we're going to talk about GLP-1s in the context of peptides as well. Okay. And I like to use this analogy. I know everybody here has been in a room when a bunch of women to get together that haven't seen each other for a while. And there's a lot of yelling and screaming and hugging and like squealing and confetti and all the things. It's kind of the same thing when your body receives an injectable peptide. As we age, we make less and less of these things in our body. That's all a normal part of aging. We make less growth hormone, we make less melatonin, we make less ATP. We process things worse as we age. And so when your body receives that very clean, direct, targeted signal, it's like a party going on and they become very effective because your body's like, I know you, I've missed you, I know exactly what to do with you, let's dance. And you oftentimes get what we call an experience with a peptide very early on, meaning you know it's working, you can tell something is happening in your body. Not every peptide is going to provide you with an experience. They're not all exactly experiential, but many of them are. And if you are following a good peptide protocol and you have a good medical team or a good coach who knows what they're doing, you want to start with those experiential peptides so you see what it's like to get the benefit of the peptide you're going to take. Haha, my button's working. Okay, let's talk about route of delivery because it really makes a big difference. Anything that goes in intravenously is going to have a very quick effect in the body. Intravenous is also cumbersome. It takes a long time to sit there and deliver it. You need medical staff, great bioavailability. Obviously, it's directly into your bloodstream. But you have to be very cautious too, because there's something going directly into your bloodstream. The next best in terms of route of administration is going to be an injectable, subcutaneous or intramuscular delivery. Are you having a hard time seeing this? Can I make this? Wonder. So I'm afraid if I go full screen, that might not. Can you guys see it okay? Yeah,
Yeah, I
okay.
think that was helpful when you made it a little bigger. That's good.
Um, okay. So you get for bioavailability, it's right up there. I mean, it's as good as you're going to get because you don't have to deal with the stomach and all of the gastric acids in your stomach, right? Anytime that you're taking an oral the formulation and for one of the reasons why so many oral medications from pharmaceutical companies have so many other things in them, it's to protect it from your gut because the gut chews it up and swallows it and you only get so much bioavailability out of that product. There's other administration routes, sublingual, buccal, or topical. Again, if we're talking about getting something very effective in the body, we want to inject it, plain and simple. Most of these peptides are going to be administered subcutaneous. That just means into the fatty layer of the dermis, just the fatty section. You can pinch just about anywhere on your body and find a little bit of fattiness. Typically, what we're talking about is the lower abdomen, the outer saddlebag around the thigh, maybe the inner thigh, or potentially on the fluffy parts of the arms. Those are usually where we're talking about when we're talking about injecting peptides. This is a little QR code if you guys want to take a snapshot of that. You can download my free peptide guide. It doesn't have all the peptides in it, but it's got some basics. It's a nice little reference. I'll leave it right here for a moment so that you can do that. Let me find the chat also because nope, no questions yet. Okay. And if you didn't capture that, it's not downloading for you, let me know. I can always email it over to you. So let's kind of talk about some of what I call essential peptides for midlife. Um, Let me back up. I don't have slides for quality in manufacturing, but I want to do that because that does give me my background in pharmaceuticals gives me a pretty unique perspective, right? I worked for one of the largest generic pharmaceutical manufacturers in the world. Nobody would have known them by name, so it really is irrelevant. But I understand pharmaceutical manufacturing. Um, when you get a branded drug, we kind of talked about this at the beginning, there's this API, this active pharmaceutical ingredient. Pharmacists often call it ADI, active drug ingredient. It's the same thing. That is the pure formulation of the molecule that is being tested in all the clinical trials. You need drug companies to do human clinical trials because they're the ones who front all the bills and they look to see what the side effect profile of these products are versus what they're not. And I love to point, kind of fingers at the supplement industry, the natural wellness and supplement industry, those companies aren't spending the money to do human clinical trials because number one, you have to have enough money to do that. And two, you got to hope that your product's really going to demonstrate what it does. And so there's a lot of smoke and mirrors when we're dealing with supplements. Do they work in the body? How do you ensure that from manufacturer to manufacturer, the supplement's going to do what it does? So those trials just don't typically exist in humans. So these branded drugs or the drug companies that are manufacturing the API in the United States, manufacturing is extremely expensive. So your drug product, your API, your ADI comes from rest of world. That's just how it is. It doesn't mean that if your active drug ingredient is coming out of a manufacturing site in China that it's bad. It just means that China has a much more cost-effective manufacturing facility. And it still means that the FDA has to inspect that facility at least once every 7 years. So China and India tend to be the two places where most of our drugs are going to be and our medications are going to be manufactured. And a lot of those same places are also going to be manufacturing the peptide molecules as well. You're going to have certain places that will have their raw source material of their peptide that are going to be manufactured in the same facilities as your drug companies. FDA regulated, FDA inspected sites. That means they've got the processes, they've got the regulations. They know that at any given moment, the FDA can pop in, although we understand it does not happen as often as it should, and there are plant shutdowns all over the world. But just because it doesn't get manufactured in the United States does not necessarily make it bad. And I want you to, it's going to be hard for you to kind of track down what the good of it is and the bad of it is. That's why you have to find trusted sources and people that you can rely on that know the back end of the manufacturing so that you can get quality peptides. So you they don't have the peptides don't have the same standards that your medications do because these peptides are not owned by the pharmaceutical companies, right? These are, and there's been a huge battle for them, right? The pharmaceutical companies would love to get their branding on them. They would love to get a patent on them, but luckily, because they are just raw molecules, that's not happening. So that means they are more accessible to us, but you have to watch out for what we call the gray market. You cannot purchase a peptide on your own on a website, not a reputable peptide, unless you filled out a medical approval or a medical form or a medical assessment that a telehealth doctor who is licensed to practice medicine in your state is going to review. We need to see, or that telehealth provider needs to see that you have nothing in your health history that is going to cause you to have a potentially adverse event to these peptides. Now, mind you, the peptides are typically safe because, again, they're very clean, they're very targeted, they're mostly things that we've already had in our body and our body knows what to do with them. But there are instances where if you've got a pre-existing cancers or a history of this or that, it's not really ideal for you. It's why we need to have a medical professional's eyes on your background. They're assessing you for appropriateness for treatment and any exclusionary criteria. There are sites that will allow you to just go on and purchase them. And sometimes there'll be a doctor who has their own portal and their own supplement line. And within that supplement line, you can just go and click, 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 and order whatever peptides you want to do. And the doctor is not even having you fill out an assessment or at any point, right? Just because you're being treated as a patient by that doctor, you're just like, click, 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 I'm just ordering and it shows up. A lot of the time, those peptides are going to come out and they're going to be labeled research use only. Okay. So you have professional use that goes to pharmacies or go to doctors' offices so that the doctors themselves can legally and safely reconstitute them. But then you also have the research use only that have been manufactured in sites that are not following or necessarily guaranteed to follow the same regulations. So you need to look at any bottle of a peptide that you may have ordered. And it better not say research use only, because if it says research use only, that also means not appropriate for human consumption. And a lot of times it will follow it up and say, or veterinary consumption. You need it to, the doctor needs to send it to you. The doctor needs to know every time you're ordering something and approve you for everything that you order. And I tell you this because I've seen doctors' sites that are literally selling research grade peptides to their clients, their patients, and it is egregious. Um, so you can get your peptides from a pharmacy and have them sent to your door where the pharmacy is doing all of the reconstituting and they're formulating exactly for you what your dose should be. But 90% of those pharmacies also fail third-party audits, right? So we see like these are imperfect systems. If I'm a business owner and industry-wide, I have a 90% failure rate because processes and standards in pharmacy um, guidelines are that kind of stringent, and they should be. I'm probably not going to elect to do third-party testing if 90% of the time it's going to slow down my productivity and my revenue. So many of those pharmacies don't. So what I do is I look for pharmacies that opt in for third-party testing, meaning that before they can actually dispense any medication to you, they have to hold all up that entire batch, even though it came to them somewhat pre-tested. Once they put it all together, it all has to be retested before it can also go back out to you. And there are pharmacies out there that opt in for that testing, and those are the ones that I work with. Now, again, in our clinic, we have access because we are run by a licensed medical professional to all of the peptides so that we can dispense them personally for with professional use and with medical oversight. So we are also able to do that. So you have the option of deciding sometimes, do I want this to come from a pharmacy and just have the pharmacy ship it? Or do I just want Momentum Integrative Wellness to go ahead and send me my peptides? What is either the most convenient or what am I the most comfortable with? Okay. So that's a little bit of background. And if there's questions, just raise your hand or pop them in the chat or unmute yourself or whatever you'd like to do. Okay, that was a little bit about product quality and sourcing. And again, like, and I don't even want to say like that these compounding pharmacies are bad, right? There's a lot of times where the new guy that they hired, and he's doing their ordering, is thinking that they're just getting a really great deal and not recognizing that they're getting knockoff product because that person just hasn't been in the industry longer, right? So those mistakes do happen, but the problem is we want to mitigate those mistakes because we're injecting it into our bodies. Okay, GLPs. What are they? These are also peptides. They are phenomenal for weight loss. They are phenomenal for reducing inflammation. That's why I like to talk about them in midlife because most of us are at least there. Um, so we have two formulations. You kind of have one on the left, one on the right. We've got brand names there in parentheses. So we have semaglutide. It is a single receptor, works on GLP-1. Its brand names are Ozempic for diabetes and Wegovy for weight loss. Again, this is all the same thing. Same thing. They just branded it differently because they found out after it was working in the diabetic population that they could go back and get another indication and really open up this huge billion-dollar weight loss market. And it has been phenomenal. This is not this is, I think, a third generation GLP-1. So when GLPs started to come out in the early 2000s, this is not Gen 1, Gen 2, this is Gen 3. You see up to about a 15% potential fat loss in the body. There can be significant nausea and constipation. I find that the semaglutides, whether it's compounded or whether you're taking it branded, can be a little more difficult to tolerate. And they just don't push the fat loss for people that I see happen with tirzepatide. There's also less of an effect on insulin resistance because, again, we're just dealing, and again, it's still indicated for diabetes. It still does work in the diabetic population. It still does provide weight loss. But if you're going to compare it to something else, I prefer tirzepatide because you're hitting two receptors, GLP-1 plus GIP. It provides a more robust fat loss profile for the right clients, right people. It tends to be a little bit more tolerable. And it does really help re-regulate that insulin sensitivity much better and much more effectively. The food noise control with the tirzepatide slash Mounjaro slash Zepbound tends to be really, really phenomenal. That tends to be one of the biggest things that I hear from people say. It's just so freeing how much more time in their day, how much more space in their brain they have when they're not spending every waking minute thinking about food or what the next meal is or what they're going to prepare or what they feel like eating versus what they should eat versus how they feel when they eat versus what do I really want. It's very freeing, and I can speak from personal experience. So we've talked about these are the branded. These come in an auto injector. You do not have flexible dosing. You're going to inject it, whatever the dose is, you're going to inject that, and that's what's going into your system. The nice thing about compounded versions of these medications is a couple of things. We get flexible dosing which is nice. You don't have to always jump to the next dose that was studied in the clinical trial. Because again, these clinical trials go on for 9, 10, 12 years, and it costs millions of dollars. Once it's received its approval, nothing about that drug can change. Not the delivery mechanism, not a stabilizer that's in it, not the dosing schedule. If the drug company wanted to say, oh, let me add an additional dose, they have to go back and do another study to be able to do that. So it is not in their best interest to go study additional if they don't have to. But the compounding pharmacies don't have to do that because they're just making medication alterations. The other benefit too, I find, is most compounding pharmacies, I don't know any that do use propylene glycol, don't use propylene glycol. That is the stabilizer that the drug companies put in Mounjaro, Wegovy, Zepbound, and Ozempic. Why? It's cheap. It's allowed here in the United States, but yes, it's a known carcinogen, cancer-causing agent. So you don't have that when you're taking a peptide, a compounded version of the peptide. You can also customize your peptides, or at least your GLP-1s. Many of the pharmacies are offering customization with B12, maybe L-carnitine, whether it's glycine. Sometimes it's B6 or B12 you can um, ask for. And then the whole reason that compounding pharmacies kind of came into existence was not just that flexible dosing, but also to make alterations to reduce side effects. So, especially in a lot of the cancer drugs, or some of the very um, rare disease drugs that come with a lot of side effects, the compounding pharmacy can alter the formulation just enough to reduce the side effect profile. So that's kind of why they exist. But I say you just want to ask to see the bottle. If this is coming direct from a pharmacy, you're good. If you're getting it from your doctor's office, make sure that your bottle does not say research use only. If it says professional use, it was formulated in the same manufacturing facility as the pharmacy will get their product from. One's going to go to the pharmacy, one's going to go to the physician. Okay, now we're going to talk about some other peptides. So, one of the most foundational peptides that I love to talk about, we call this the Wolverine stack, and I probably should have put it here on the slide. It's BPC 157 plus TB 500. It is a combination of two peptides, and we do call it the heal and repair peptide. This is phenomenal for getting your body kind of back in business. This is great when it really helps to target and reduce systemic inflammation. Very similar, like a GLP-1 reduces systemic inflammation, so does this BPC TB500 combination. But it's also going to pinpoint where in your body you need repair. So whether it's gut healing, which BPC really does target very, very well, or there's some tissue muscle repair that needs to go on, BPC kind of finds it, and then the TB500 goes to that place to kind of heal it. There can be things going in your body that you don't even know about, and it's able to kind of go after and heal and repair before they become a bigger issue as well. So it's one of those reasons that I like to call it a foundational peptide, because it kind of isn't just like the key that unlocks one door. Its formulation allows it to be like the skeleton key that can go in all the doors in the house. Again, it addresses systemic inflammation. How that works is it enhances angiogenesis, which is the production of more blood vessels from your current blood vessels, right? So when you have more blood flow, you get better oxygen delivery, um, nutrient delivery, you get better uptake of your other peptides and hormones that are in your body. This is one because of the angiogenesis factor, because of that production of blood vessels. If you have a history of certain cancers, your provider really needs to take a deeper look at what's going on in your body, how long you are out, how long you've been in recovery, cancer free. There's two schools of thought on whether or not you should take this combination if you have any history of cancer. One is if there is cancer dormant in your body because of the angiogenesis, the increase of production of blood vessels or reformulation of blood vessels, it could cause dormant cancer to grow because now it's growing and it's regenerating more. That's one thought. The other school of thought is if I have cancer lying dormant in my body, and I'm very proactive in my health and I'm constantly running labs and I'm doing things to be as healthy as I possibly can. I want to be able to catch this at the earliest, quickest, fastest stage possible. And so if it causes me to be able to find something very early on in early detection so that we can do something about that, then that's the route that that person wants to take. So really is the conversation with your provider as to which cancers are going to be most important to really kind of look out for and, what is your philosophy and how you want to handle that? One second, I've got a call. And that's because I did not bring my water up here with me. Any questions here? This is one that I take routinely. If you're curious, this is a 5-day on, 2-day off typical protocol. Glutathione. This is one of my favorites. Glutathione is found in just about all of Momentum Integrative Wellness's peptide memberships. It is, again, so important. It is your master antioxidant. It is phenomenal for liver detoxification. It's great for cellular detox. Technically, it's not a peptide, it is an antioxidant. You can take this subcutaneous if you're really brave and you've been injecting for a while, then you might go the IM route, which is what I do. It's a big long needle. Um, but living in Florida, I love this for my snowbirds because my snowbirds like to come down here and party their rocks off all winter long. And I'm like, y'all, we got to take care of this liver. Like, can we get you on a regular regimen of glutathione before you keel over on me? Um, but this is great for, helping to combat the free radicals and doing all the detoxification things. Great for your skin. It can cause, early utilization of glutathione can cause skin issues to kind of come out. And then as you're purging them, it'll kind of calm down. It's not always the case, and it is not that often, but it should improve your energy overall and kind of how you feel with mental clarity as well. So we utilize this in a peptide cycle in all of our peptide memberships because it's really just phenomenal. If you're taking it in a powdered form orally, don't bother. It's just saying. If you have it, you may as well use it up, but you're not getting the benefit from it that you would by taking it subcutaneous or intramuscular. And again, they also have this in IV, right? If you go to an IV clinic, you can have glutathione put in your bag too. But it is hands down one of my favorite. This is a slide that everybody loves. So these are two of my besties right here. GHKCU, the copper peptide. This is the glow peptide. This is what makes your skin super shiny. I'm not oily. I'm just very shiny and glowy. But like the Wolverine, the combination of BPC 157/TB500, it goes and it heals and repairs more of like um, muscle, tendon, ligament tissues. This is more of the skin repair. So again, those three should always be used in post-surgical recovery protocols. I always tell people, how good your orthopedic surgeon is because, down here in Florida, we're having a lot of people get their knee, hip, shoulder replacements, all their joint replacements down here. And if these peptides are not in your post-surgical recovery protocol, I know that your um, orthopedic surgeon is not really on the up and up of the new healing medicine. Typically, when patients go back and they're seeing their ortho for follow-up post-surgery, they tend to be a lot farther in their healing earlier on because they're doing the things that allow their body to heal faster. But the women love this because it's great for hair, skin, and nails. This can be a little spicy. So it is a blue peptide. I actually had a friend of mine say that she thought it was contaminated. She's like, why is this blue? And it sat there for like 2 months in her refrigerator and she didn't think to ask. She just thought it was a bad batch. And I'm like, oh no, it's actually like copper is blue and like it is absolutely okay to inject, but it causes a lot of redness. It can cause kind of a hard bump, a raised bump. Um, it can sting a little bit. It can be kind of itchy. Like I injected this morning in my thigh and I'm like, why is my thigh like there's an annoying kind of a spot here? I'm like, oh yeah. It's the GHKCU. So a lot of times what I'll do, and honestly, this effect will usually last for like 30 days. So we cycle this anywhere from 8 to 12 weeks, and then we take a break. I say usually 2 months, and then we take like a 2 week break, and then you go back on it. But it's almost always that entire first 30 days before your body stops reacting to it that way. So one of the things we can do is we can use a little bit longer of a needle to get the injection just a little bit deeper down into that subcutaneous fat. So it's not sitting at the top of the dermis, not as irritating. So I call it the spicy peptide. And honestly, you don't want if you are having a reaction like 98% of people do, you really don't want it on the belly. That's, in my opinion, one of the most annoying spots. I prefer to have the annoyance maybe like on the thigh, or you can kind of do it like back in the love handle area. Those two places just seem to be less bothersome. But when we've done it on the arm, when we do it on the belly, it's like, oh, no, that's really uncomfortable. Let me put it somewhere else. Sulfur allergy, not sulfa, sulfur. Or do I have that backwards? Oh, hold on. This slide might be incorrect. Let me check myself real quick. I'm having a perimenopause moment, don't mind me. Because I actually just had a client who we thought couldn't take this. We had it backwards. True sulfite sensitivity. I need to change that. You need to have a true sulfite sensitivity if there's going to be an issue. So ignore that little line. I will fix that later on. Um, okay. Now we're going to go to this bottom block. Sermorelin, tesamorelin. Let's see if I can you guys see that still? There we go. Okay. Sermorelin, tesamorelin, CGC 1295. These are body composition and sleep peptides. Growth hormone releasing peptide. You're going to stimulate production of your own growth hormone by your pituitary gland. As we age, we make less and less growth hormone. Obviously, we're not growing really much past the age of our early 20s, and that's really where we peak. Growth hormone is really beneficial in recovery, in stamina, in muscle build. The reason you're hearing so many people harp on and speak to the amount of muscle that you want to have on your body, it's because it's supporting your bones, and we lose bone density the older we get. For women in particular, in perimenopause, we really speed up that bone loss unless you're doing a lot of the things to help either protect you from bone loss, in which GLP-1s actually do reduce the rate of bone loss that you're having. So it is actually good. They're not going to help you build more bone. That's going to be like that hard impact kind of um, workouts, but you want the muscle on your body to support the bones that do get a little bit more brittle as you get older. So there's a correlation to longevity depending on how much muscle mass you have. So at first, it might seem like this is just those gym bros, those gym rats, the people who all they want to do is look at their muscles in the mirror, talking about muscles, and they're not really explaining what the role and the benefit of adding more muscle mass the older we get. Muscle mass is longevity. And these peptides help your body preserve and or build that muscle mass. But it also helps with overnight recovery and sleep. So I have yet to have, okay, I lied. I think I have one patient that has taken Sermorelin that did not call me back within the first 3 days and say, holy crap, I had the best sleep of my entire life. So for women, because we have more women on here than men, sorry, Robert, for women, Sermorelin is really great for building and kind of sculpting lean muscle mass. it also will target some visceral fat, which is really great. So you're getting kind of that muscle sculpt. If you're working out, it enhances what you're already doing. And it's kind of that one peptide that you take where I hear women say, like, I have an ab all of a sudden. Like, I can see my ab, or I can see that little definition of my arm. Whereas you really couldn't see it because, again, it is targeting to slim some of that fat and some of the visceral fat inside, but it's also helping sculpt and lean those muscles. The deep sleep and overnight recovery is phenomenal. Like, when I say my ride or die bestie is Sermorelin, I just about cry when it's time for me to cycle off of it because I don't want to be without it. I love how it makes my body feel. I love the deep sleep that I get when I'm on it. You don't wake up groggy. You just like that will always be part of my stack. Tesamorelin, also, these are not growth hormone, like you're not taking growth hormone. These are stimulating your body to produce more growth hormone, okay? So that's why it's very different than just what we're thinking about with like steroids and taking hormones. Tesamorelin is kind of the opposite of Samorelin. It's like the granddaddy. This is the one where we're going to build some muscle bulk. I have a lot of people who, want to add more muscle. So when I went off Sermorelin last time, rather than doing nothing for 2 weeks, I went on Tesamorelin. I thought, you know what? I'm going to see how my body reacts with it. I still prefer Sermorelin. I haven't finished up all my Tesamorelin yet, but I'm okay adding a little bit more muscle mass to my body because I just don't have a body type that's going to get overly bulky. So I really just kind of wanted to see how it felt in my body. But I love this one, honestly, for men because it also supports that stamina and the recovery. And when I'm talking with a man and he's maybe in his mid 40s or whatever, and again, the first thing out of the guy's mouth is almost always, do you guys do TRT? Do you have TRT? Like it's always about the testosterone for the guys. And while testosterone is very, very important, if you can get the growth hormone protocol in your body first, because that's also going to help, and I use the word regulate loosely, but it will stimulate your other hormones and changes to happen in your hormones. And then you might end up just taking less testosterone. So I love for the men, letting them know we can do a tesamorelin or a combination tesamorelin, ipamorelin, and it not only helps with their gym workouts and their overall physique, but they get that recovery time and they get that increase in stamina. And you know what I'm talking about when I use the word stamina. And so it kind of gets them to think, like, you know what, we can use peptides in addition to other things too. And if we start with the peptides, then maybe we'll just take a little bit less testosterone. Um, and you can also see both men and women can see an increase in libido by taking this class of medications. It can be really quite phenomenal. And it can also help with some cognition and some mental focus and mental clarity. Um, Again, hormone-dependent cancers you really do want to be very careful with, and you want to talk to your medical professional for clearance on that. Okay, NAD. There's always a ton of questions around NAD. NAD is not a peptide. It is a coenzyme in your body, nicotinamide, adenine, dinucleotide. It's really the spark plug and battery combo for your mitochondria. And it always, we talk about before the brain fog happens, you got fatigued. I promise you. Maybe you didn't notice it, but before brain fog sets in, that exhaustion, that fatigue happens, and that's when your NAD is dropping. And this is what's going to drive that ATP, which is energy, that production in your body. Your mitochondria need ATP for energy. So what I love with NAD, and again, if you're not low on NAD, you're not going to have an effect from it. But if you are low, people will notice a significant change in their energy. You can also start to feel really crappy before you feel better because now your body has the energy to kind of handle some things and clean up some things inside that it needed to handle before. So you might go through a period of feeling really junky when you first start taking NAD. You really want to give it a good 6 weeks before you make a decision as to whether or not it's working well for you because it needs some time in your system. You can have an experience with it sooner for sure, but this would be a good 2-month cycle, but at least 6 weeks to see what it's going to do inside your body. here's some common things that it can help with, right? This memory dips, the post-COVID brain fog, people who are, high performing individuals, high, stress, high job demand, lifestyle demand. Maybe you're in the sandwich years, you're taking care of aging parents and your family at home. Maybe you're in the middle of a divorce. Maybe you're in the middle of a move. Maybe, who knows? You've had financial changes. All of that chronic stress, it's going to lead to oxidative stress. It's going to exhaust you. It's going to deplete your supply of NAD. Also, this is another one that they can put into an IV bag for you. If they do it IV, it takes a little while. It can almost take your breath away a little bit when you almost feel like you have like a heart palpitation when you take it sometimes. It's not dangerous. It's just kind of that dose response. You say, oh, I can feel it, like I got a little whoosh of something and it immediately goes away. But if you're doing it or I'm sorry, in an IV bag, um, it kind of lasts a little bit longer because it's going directly into your bloodstream. MOTS-C. So this is another one that's going to help with overall energy. But while NAD is, and going back here to NAD real quick, almost always for my autoimmune patients, I'm like, let's get you some NAD. Autoimmune, we're going to Wolverine all day long and NAD all day long. We're going to target systemic inflammation. We're going to help with or do some things to help with energy and brain fog. And that patient population does really, really well with Wolverine and with NAD. Um, MOTS-C, it can be a little bit confusing because it almost sounds like it's working like NAD. Um, but this is another way to kind of restore energy and or metabolic processes. It really upgrades that ATP, your energy metabolism. So while NAD is responsible for helping you produce more ATP, this shows your body how to utilize that ATP in a much different, more efficient way, right? So again, we're also talking about ways to reduce oxidative stress. Some of the main culprits for low energy, feeling fatigued, feeling crappy, it's going to be oxidative stress, mitochondrial dysfunction, and inflammation. And if we can tackle those three things in your body, inflammation, mitochondrial dysfunction, oxidative stress, you're going to see huge changes in how you feel. And so these are ways to do that at the mitochondrial level. People tend to call MOTS-C exercise in a bottle, and I hate when they say that because I don't want someone to think that this is going to give you the cardio workout that you're not doing. I don't want someone to think this is going to cause you to burn the calories or lose weight like the GLP-1. It can it can help when you're in that fat loss plateau when you're on a GLP-1, or maybe you're not taking GLPs and you're in this fat burning place and you are plateauing, but the reason it's going to get you through that plateau is because it's going to work on mitochondria. It's not actually giving you an exercise effect. And so if you are not an active individual, I'm not going to recommend this for you. I want to see you have a decent level of activity, and we're going to then make the activity that you're doing work better for you by taking this, if that makes sense. And so I kind of want to do a side by side here because it can get a little confusing, which are these, NAD is here's the energy, let's use it. MOTS-C is we're going to change how your body's using the energy. So NAD's a little bit more subtle. It's very foundational. Sometimes you didn't feel anything. And again, it's being used up right away. Your stores might have been really, really depleted. Stay on it for, we want to do a 2-month cycle. Peptides are cycled in ways so that you can get benefit in your body from it. With the MOTS-C, again, it's more noticeable in your stamina, your overall fat loss, your metabolic flexibility, how you're working out, the pumps that you're getting at the gym. So NAD powers your mitochondria. MOTS-C is going to update or upgrade your metabolic programming. The other thing too, when we talk about peptide cycling, is your body really can only handle the signal for so long before it's kind of like, the excitement wore off. It's there. but I'm not so excited to recognize it. So while it's there, I'm not gonna do anything with it. So every peptide has an ideal cycle to it. Sometimes it's 8 weeks, sometimes it's 12 weeks, sometimes it's a short stint. There's a lot of people out there using MOTS-c as a maintenance peptide, and I disagree with that. Um, I'm finding, and so do most of the experts find, that you want to take a much higher loading dose of MOTS-c in a short period of time, 2 to 3 times a year. Because again, what are we doing? We're changing how you're going to use the energy that your body's making. So why am I trying to take this at a lower dose, maintenance consistency, versus giving my body what it needs to re-regulate how I'm handling the energy, and then going on my merry way, and then coming back to revisit this after a while? You really only need, at best, 2, maybe 3 cycles a year, unless you're really at a tough plateau and you're really dealing with some intense insulin resistance and you've become um, mm, treatment resistant to some of the GLPs, and we're not ready to make a dosing change. So we can do those things with MOTS-c. We can attack the body in a different way at the metabolic level. And there's most peptides, and say this, they're very safe. I had a patient call me. She was getting her dosing mixed up. Um, and like you'll be doing something kind of mindlessly, and then someone comes in and talks to you, and they kind of distract you, and you're suddenly not paying attention. And she goes to put her peptide away, and she's like, "What did I just do? I just," she goes, "I just took 100 units, half of her entire bottle of a peptide in one injection. That was Sermorelin, because she was supposed to take 100 units of glutathione. Different dosing, different schedule. She'd already done that, but when she was just talking, her daughter came in, she was talking to her, she did that, and then she realized, oh my God, I just blew through half my bottle. She's like, am I gonna die? And I'm like, no, your body's only gonna use what it's gonna use. Unfortunately, that was a very expensive shot. It was half your bottle all at once. Um, and it was on a Thursday. I was like, you know what, give it a couple days, let your body just, again, you're not gonna have any negative effect from that happening. It's just kind of the rest is being wasted, what the body can't use. And so there's nothing more frustrating to me than somebody who is trying to wing it with peptides, because they're not cheap. Health is not cheap. Preventative medicine is not cheap. And we want to do things to maximize what you're doing and not waste your money. And a lot of times, if people aren't cycling them properly or using them in the right dosages, or you're putting too many things together, then it's just a waste. And I really hate to see that for people. I like to play this little fact or fiction. Um, we didn't go over too much of this, but I could just either put it in the chat or raise your hand or unmute yourself. High dose GLP-1 therapy may result in a 12% reduction in muscle oxidative capacity. What do we think? Do we think that's true or false? Do we think that GLP-1 high dose is going to reduce your muscle capacity or your strength capacity? Any guesses?
I
No,
don't think so.
correct. That's statins. That is a statistic for statins. Second, continuous use of GLP-1 has been associated with a 25% accelerated decline in grip strength over a 10-year period compared to non-users. Okay, so this is the strength one. Nope, also statins. GLP-1s have a very favorable cardiovascular profile, and as a class, tend to lower blood pressure. They also tend to work very favorably on your lipid profile. So they can, in many cases, and we're talking, a year or two in, you can see a reduction typically in LDL. Not every single patient, but you can see a reduction in LDL, but it's not obliterating your total cholesterol like a statin does, which is quite phenomenal. So we like it for the cardiovascular profile of it. We love it for increasing kidney function, especially in our older population. We love it for the neuroprotective. Well, here we go. GLP-1 demonstrated a 33% reduction in risk for dementia-related disease.
True.
I spelled dementia wrong.
Yeah, you did.
Yeah. See, we're very casual here, guys. This Canva doesn't really do much of a spell check, so yeah, that is true. And they actually studied Ozempic specifically by brand, and you are really able to extrapolate that across all the classes of GLPs. And recent studies on GLP-1 have been found to increase breast cancer tumors in animal models. True or false?
I haven't heard that. False.
That's false. They actually have shown so far showing a 20% reduction in breast cancer tumors in mice. So very good data right now. When you start looking at the actual data behind these peptides, remember GLP-1s are peptides. Um, they are phenomenal for longevity. And when you start seeing cardiologists promote this in their geriatric patient population, I don't know how many ladies I have in their 70s and 80s that are taking GLP-1s, and it's so good for them. It would have been great if we could have started them a little bit sooner. Again, I cannot stress this enough. You can't access peptides without either a prescription or a medical approval from a licensed medical professional. This is ours. This is Stephanie. This is my business partner. She is the one who creates and signs off on all the patient protocols, all the patient dosing, all of the crazy fun ideas that we have, all of the memberships that we put together to make sure that everything is safe and a good idea for people. You don't see her a whole lot, so I wanted to put her happy, pretty little face right there.